There is a growing danger in the Pacific. Hidden. Secretive. And every year, it helps claim more and more lives.
While the doctor and nurse try to revive her husband, Ofa Havea feels helpless. She can't believe Sione has had a stroke. He's only 39. The doctor explains to Ofa that Sione's high blood pressure probably caused the stroke. She tells Ofa that one of the causes of his high blood pressure was likely to be the salt in his diet. Ofa is surprised that too much salt could lead to a stroke. Sione doesn't use much more than anyone else. The doctor tells her that a number of other hospital beds are filled with people who have had stroke or heart attacks, as well as stomach cancer and kidney disease. A major factor in all of these diseases is too much salt. It's the sodium in salt that is bad for health, as well as other sources of sodium, such as MSG. But the majority of sodium that people eat is in the form of sodium chloride, which is table salt. At home, Ofa begins preparing the dinner for her family. She thinks about what the doctor had said and how she needed to try and reduce salt for her family. She looks at the food she's using and realizes that it has salt. She checks the noodles she's cooking, nearly 5 grams of salt. That's a whole teaspoon. She checks the tin meat she's using, 750 milligrams of sodium. She looks at other food she has in her kitchen. Oh, this one contains salt too. More salt? This one says it contains salt, but doesn't say how much. People only need very small amounts of salt, between 1 and 2 grams a day, to be healthy. Ofa begins to realize that she's feeding her family much more than this amount, which is one of the reasons for her husband's stroke. She looks at the snacks that her children eat as well. That one has salt. That one too. And that one. Ofa takes Sione out to his village to see his family. Even though they are cooking foods that they grow, she sees that they use a lot of salt in their cooking. Some of the seafood they actually cook in seawater. Seawater also has a lot of salt. That adds to the amount of salt they're eating. When they're eating, she also notices how much salt they put on their food. Not 1 or 2 grams like the doctor had told her was acceptable, but plenty. Ofa knew she needed to do something to keep her family healthy.
There's a significant or even exponential rise in incidents of stroke, heart failure, hypertension. A lot younger and a lot more people. So an increased number of cases, and of course we're seeing younger and younger patients with those diseases. Yeah.
First, it's well established that excessive salt consumption links with stroke and heart disease specifically. And not just getting those 2 diseases, but actually dying from them.
With salt leading to water retention as a clear link with raised or elevated blood pressure. And as we know, chronically elevated blood pressure leads to complications, and one of those feared complications is stroke.
Most countries, about 30 to 40% of that population actually have high blood pressure. When you relate that with the clinical figures, the leading cause of death in the Pacific is non-communicable disease.
So it's the added salt that they put into the food that we don't actually see when we eat them, but it makes the food very, very salty, such as sauces like soy sauce and the flavorings that people add to noodles and that. So they are all referred to as hidden salt because they're already in the food that we buy, but we don't put the salt in when we eat them or when we prepare the foods. It would also include foods such as bread because they put a bit of salt into bread.
Non-communicable disease has been declared a crisis in the Pacific, and it is both at health burden level, at economical level, productivity. People don't know what retirement is. They die before retirement age, and there's three main outcomes that cause this early demise of population. It's either the heart, the brain, or the kidneys. And in all of these three, stroke, heart disease, and renal failure, salt plays a big part in it.
In 2004, we did a survey which was a repeat of a survey we did in 2000. And the data from there showed that people in Tonga generally are consuming about 3 times as much salt as they should be. A lot of the children here are eating the noodles raw with the flavorings added to it. They eat it like a snack kind of food.
And now more and more of the Pacific people, not only now but future, will be relying more on the processed foods, which uses a lot of salt. And that's the area of concern for us at the moment. And if we reduce salt, we actually reduce the chances of getting high blood pressure and the complications.
But reducing your intake of salt is not always as easy as you might think.
John Evula was being more careful these days with what he ate. After his father had a stroke due to high blood pressure, Johnny decided to eat less salt. But that wasn't so easy. Because he worked in town, all the takeaway food seemed to already be salted. Finally he found some food that wasn't already salted. Oh no, salt? Johnny could see that it was going to be difficult to reduce his use of salt by eating takeaway meals. In the grocery store, Johnny looked for foods that didn't have salt or sodium on their label. He checked each can that he normally bought. Salt, MSG, salt again. There must be some foods that don't have salt or sodium added. Oh no, even more salt.
Pacific Island countries are recognizing the need to raise awareness on salt content in foods and the need to reduce salt in local diets. And this may require action by governments in the form of new policies.
Currently, we do not have food standards policy, but we would really like to see a policy developed so that people are aware of the food that they eat, how much salt is in each food that they buy, so that they're able to make easier choices. And the policy, we would like to look at labeling, because we believe labeling is a tool that can be used not only by the people, by the consumers, to educate themselves on how much salt or sugar or fat in the food that they buy.
We are working on food labeling at the moment. That's one of the big moves, because currently our consumers in Fiji actually look at the price to determine whether they buy a product or not. But in our endeavor to reduce salt, we are moving towards improving the labeling, the nutrient information.
Pacific Island government efforts to reduce salt in diets have been championed by the World Health Organization with support from the George Institute, who have been assisting countries to develop activities to reduce salt intakes. This includes initiatives to engage the food industry to reduce salt in foods and meals and campaigns to change consumer behavior.
Too much salt in the diet can lead to high blood pressure, a major risk factor for heart disease and stroke.
Awareness needs to be done in a lot of the countries just for people to be informed of the link between salt and high blood pressure in the same way they link sugar with diabetes in that sense. The work with the industry needs to be really scaled up.
Most salt that we eat is hidden in processed foods and meals. So governments need manufacturers and food providers to cooperate and reduce salt in products and meals. In Fiji, food manufacturers have assisted national awareness efforts by reducing salt content in some products and advertising this to the public.
There have been about 3 to 4 companies who have declared publicly that they've lowered their salt. Not only that, they are actually doing their marketing or advertising their products by saying that there is now reduced salt, and reduced salt gives rise to good health.
Tasty chicken flavor now with 15% reduced salt for your goodness and health. Hungry, yaar?
Eating less salt does not have to mean less taste. In programs in other countries, food companies gradually reduce the salt in their products by 10% a year over 3 years. Most consumers didn't even notice.
The key in food industry is to gradually reduce the salt in their product over time. Taste is something that you adopt, you know, and so you can win consumers off. It doesn't affect the profit margin of the companies because people get adapted to the taste.
The combined efforts by donors, governments, food manufacturers and caterers will help provide the public with more opportunities to purchase lower salt products for their meals. These efforts should complement attempts by the public to change behavior to reduce the amount of salt in their daily diet.
Offa wanted to help her family eat healthier. She began to use only fresh vegetables, root crops from her garden in their meals. In making dinner, she hardly used any salt. Instead, she used lots of fresh herbs and spices. When she used locally salted fish or meat, she soaked it in water to get rid of some of the salt before cooking or eating it. When shopping, she checked the foods and selected products with the lowest salt content. Offa was happy that everyone in her family was enjoying their food with less salt. Uh-oh, almost everyone. Some people just have to be reminded.
There's 3 main areas of salt reduction strategy in Fiji. One is salt in the home, making sure that they reduce salt in the home. The other one is salt eating in the restaurants, or eating out salt. So that's where the restaurant gradings and all that have come in. And the third one is working with the food process, which is a huge, and in that area we are actually going one-to-one with the food processors. And secondly, looking at some of the regulation and legislation that we need to put in place.
Salt reduction is probably one of the most cost-effective public health programs to run. It's simple, it doesn't cost that much at a population level, and it could do tremendous results. You could be saving big proportion of population from dying early.
The World Health Organization recommends countries reduce average population salt intake to less than 5 grams per day, and that all salt should be iodized. For Pacific Island governments, reducing salt is a cost-effective public health solution that they cannot afford to ignore.